Thank you so much, Dr. Goddard. My name is Tamara Dubowitz, and I am extremely happy to introduce our first keynote by Ross Hammond. Dr. Hammond brings over 20 years of experience in complex system science modeling, methodologies, and agent-based modeling to problems in social science and public health. He is a senior fellow in economic studies at the Brookings Institution, where he is a director. He is director of the Center on Social Dynamics and Policy. He also holds academic appointments at Harvard School of Public Health and the Santa Fe Institute. Hammond is an HHS appointed member of the National Institute on Minority Health and Health Disparities Advisory Council. He also serves as a public health advisor for the National Cancer Institute, an advisory special government employee for the FDA Center for Tobacco Products, a commissioner for the Lancet Commission on Obesity, and a member of the National Academy of Sciences Food and Nutrition Board. Dr. Hammond works with modeling complex dynamics in economic, social, and public health systems using mathematical and computational methods from complexity systems science. I'm thrilled to pass it over to Dr. Hammond.
Thank you very much. It's great to be here. Make sure that you can see me. Yes, great. Excellent. Great. Thank you so much. It's great to be here. I'm going to talk about systems approaches to obesity prevention. Next slide, please. These have already been mentioned. I do have a number of formal advisory roles, but nothing that I say in this presentation should be construed as the opinion of any of these entities, just my own views. Next slide, please. So we've made quite a bit of progress from one perspective in obesity prevention, but we need to do a lot more. And what I'm going to try to do is to motivate a systems approach and what it can offer us by looking at some of the toughest challenges in trying to address this problem that we've learned over the last decade or more since a report that was mentioned in the introduction came out. Next slide, please. The first of these challenges is the extreme breadth and interconnectedness of the system which is driving obesity as an outcome. Next slide, please. I like to use this illustration to bring home this point. Many of you may have seen this before, but in case you haven't, this is a diagram, a systems map of the underlying systems and processes that produce obesity as an outcome. And it was drawn at the request of the UK government by the Foresight Group. And each of the little boxes with words in it, which I've purposely made too small for you to read, is actually a measurable factor that plays a role in obesity as an outcome. And each of the arrows is an evidence-based causal relationship between these different variables or factors. So the first thing I want you to notice about this is the huge breadth, which is why I have it zoomed out so far. There are many different sectors and levels involved here. These are color-coded with different sort of groupings that are labeled here: education, technology, media, macroeconomic drivers, etc. And this, of course, means that a multi-sector, multi-level approach will be part of the solution. The next thing I want you to notice is that this interdependence, these arrows, these causal relationships between the factors, mean that a lot of our conventional approaches to both science and policy, which focus on isolating individual causes or individual factors that can be correlated with outcomes, are not going to work very well, because this is a very interdependent system. Many things are influenced by many other things. And the final thing I want you to notice is that there's lots of feedback here. There's lots of cycles where A influences B, and then B in turn influences A. And one of the implications of that is that feedback takes time to accumulate. And so we should expect in a system like this that what happens in the short run might differ from what happens in the long run as we try to intervene to change this. Next slide, please. The second challenge I want to focus on is the huge heterogeneity in contexts and settings in which we need to prevent obesity. Next slide, please. We've learned that context really matters in shaping how we do obesity prevention. So I've shown two different kinds of contexts, just to give you an example of the kind of thing I mean. On the left is a heat map, which is showing the density of fast food across 5 boroughs of New York City. And on the right is a different kind of context, a social context. This is a social network diagram where each dot is an individual and each line is a social connection between those individuals from the Christakis and Fowler New England Journal of Medicine study. Both of these represent different kind of structured spaces in which people experience the world around them, in which they're exposed to different kinds of opportunities for eating and for physical activity, and in which they learn information from each other and from the world around them. And the complexity of the richness of these spaces and the degree to which they differ across our very diverse country means that what works in one context may not actually translate very well to a different context without some adjustment, as we'll see later in the talk. Next slide, please. The third thing I want to highlight is the diversity across the actors who are part of this system and across the timescales that we have to think about. Next slide, please. To help us think about this, I've made just a partial list on the left of kinds of actors who affect obesity as an outcome. And some of them will be self-evident, like individual consumers and retailers and the food industry. And some of them may be less evident at first glance, like community coalition leaders, for example, who we'll mention later today at some length. And each of the actors on this list has different information available to them. They have different incentives. They have different knowledge of the world around them, potentially. And if you intervene in a system like this, what you are trying to do will actually affect each of these actors potentially in a different way, even the actors that you may not be focusing on in your intervention. All of these actors also differ at each level. So not all retailers are the same, not all consumers are the same, not all parents are the same. And they adapt over time. They adapt biologically, as is shown in the upper right here. And this leads different things to happen over the life course, as well as behaviorally, they adapt. And adaptation means, again, that what we anticipate will happen in the short run as we intervene in a system like this may differ from what will happen in the long run as everyone adapts to the changes that have been made. Next slide, please. What does this all mean? Well, first of all, it means that, and I think this lesson that I'm about to mention now has been well learned by this field, is that the search for a single independent cause of something like the obesity epidemic is probably misleading, and that our standard approaches that focus on isolating or changing single drivers are going to have limited ability to engage with this kind of complex dynamic. Next slide. The second implication of all of this is that looking for a single solution, a magic bullet, a single thing we can do is not going to work very well all by itself. That is not going to fit all individuals and circumstances and contexts in which there are drivers of obesity. And so we somehow need, if we think about that big picture, we need solutions that are broad enough to cover lots of those different sectors and levels, yet somehow also context specific enough to work in very different places, in rural parts of the Midwest and urban parts of the Northeast, for example. Next slide. Finally, what this all means is that we can't just think about the short term. We can't field an intervention, wait 2 years, and decide it didn't work, because it might take more than 2 years for it to work. Or we can't decide that something is working now, and that means it will continue to work in perpetuity. We have to think about the long time horizon, the life course, the way that adaptation takes place in this system. Next slide, please. So here are some nice quotes, including from the report that was mentioned in the introduction, which advocates for a systems approach and that involves multiple levels and sectors, that takes into account the synergy of multiple strategies. And on the bottom is a quote actually from a report on tobacco control, which also looks at a systems approach. And as was mentioned, has thought through a lot of the journey that we're also on in obesity prevention. And that report really focuses on this idea that the total effect of an intervention isn't just the effect you are focused on, but the broader effect, which may involve unintended consequences or longer time horizons with adaptation. Next slide, please. This is hard to do. and I think this is the fundamental challenge that I want to highlight, is having broad but context-specific, long time horizon, short-term effective policies and strategies for intervention is very challenging. And that is bringing us to look at these systems approaches for a systems problem. Next slide, please. So I'm going to talk now about what I think a systems approach means and do some defining of terms. Systems approaches do indeed involve multiple sectors usually and multiple levels, and multi-level, multi-sector interventions are important. But I'm going to argue that we need to go actually further beyond just thinking about multi-sector and multi-level as the defining characteristics we need to involve in our interventions. Next slide, please. So the first thing that I'm going to say defines a systems approach that goes beyond just a multi-sector or multi-level is that we are really focusing on coordination and synergy between the intervention elements. So it's not just that we have lots of elements, but that we thought through how they work together. Next slide, please. And so one way that we can think through how they work together is to think about the short-term and long-term feedback loops that are involved, as is mentioned in this report right here. Next slide, please. And actually, the report, Accelerating Progress in Obesity Prevention, pioneered doing this for obesity prevention and actually in the report. And one of the ways that it did that is, in addition to using the usual filters for things which are well supported by evidence to recommend and so on, this report actually took a very novel strategy, which is to think about how all the different things it was recommending might work together in powerful ways as a package. So here's the diagram which appears in that report, which shows strategies that are recommended in our circles. And they come from different sectors of action, which are color-coded. And these big boxes are the recommendations themselves. And what you'll see, next slide, please, is that these actually point to each other when they are working together in three different ways, which are really important. And this is part of what defines a systems approach. The first is that some of these strategies are actually prerequisites for other strategies to succeed. For example, if you're going to do menu and food labeling, and you actually pair it with nutrition education first, that allows consumers to make better use of the information that's on those labels in making their choices, both in specific settings and across multiple contexts through time. Or if you're going to invest in parks and recreation infrastructure, and you have first addressed crime and transportation and supervision concerns, which are major barriers to usage of infrastructure, then those investments in parks and rec will actually have much more impact. The second kind of relationship between elements of a systems intervention is reinforcing feedback that fills in gaps. So again, thinking about parks and recreation infrastructure. If we have parks and recreation that people are using, but they're surrounded by only unhealthy food options, that's going to undermine some of the positive effect we might expect from the parks and recreation. So instead, we would like to have a reinforcing feedback by having healthy food available there at the park and recreation infrastructure. So exercise is less likely to be immediately followed by consumption of unhealthy food. Or if we are doing advertising reform and we pair that with education to improve media literacy, which may otherwise undermine some of the impact of advertising reform. And the final thing on my list here of a way of interacting different elements in a systems intervention is natural complements. So if we do advertising reform and investments in parks and recreation infrastructure, and by removing barriers to physical activity, we reduce screen time, and then we further reduce exposure to advertising. So those things are working together as natural complements. Next slide, please. Another example, which Chris Economos is going to talk about quite a bit later, so I'm only going to mention briefly here, is to actually try to map out how the different elements of an intervention that you are fielding are going to work together. What are these feedback loops that connect the different activities that are part of the intervention? How are they having this kind of synergy together? And so this is a systems map of an actual intervention, the Shape Up Somerville intervention, that has different sectors of activity and different elements of the intervention, which work powerfully together and which were able to actually have a quite important impact on obesity prevention in this community. Next slide, please. The second way in which a systems approach might go beyond just being multi-sector or multi-level is by really focusing in on implementation and sustainability. Next slide, please. One thing we've learned is that these multi-sector, multi-level, whole of community interventions are very resource intensive to field, and they're very challenging to sustain. And what we may need to get more of them to happen and to have them work better is to really think about how do we get them to happen in the first place and how do we sustain them. And doing that is going to involve engaging with community structure and dynamics. And this is also a theme that showed up in the Lancet Commission report on obesity, which really stressed this idea of activating communities for bottom-up change, which would therefore be sustainable and overcome policy inertia. Next slide, please. One example of this, which I believe Chris will also talk about later, so I will mention only briefly now, is a compact study that she and I led together. And in this study, really the focus was entirely on upstream elements. So many, many interventions focus on how changes in policy systems and environments can change behavior, which can change BMI and can change health. But this intervention really focused heavily on what does it take to sustainably change policy systems and environments in the first place, and how do we implement that? And without going through all the details that are in this intervention, which you'll hear about later, next slide, please. I just want to highlight that this is an intervention that focused on how communities are structured. So what you're looking at here is a before and after picture with dots that are individuals who are connected to each other and who have different characteristics. And the purpose of the intervention is really to help improve the conditions in the community that will make sustainable change possible. Next slide, please. The third way in which a systems approach might go beyond a multi-sector or multi-level approach is by tailoring to context to facilitate scalability. Next slide, please. This article argues that one of the challenges in multi-level interventions is thinking about which factors, which levels should we specifically address, which sectors, and how are we going to tackle them? And I would argue that the answer to that is very different in a small rural town in the Midwest than in a large metropolitan area in California. And those differences have to be accounted for in the design. And that's part of what a systems approach does, is it tailors to context. Next slide, please. Scaling across all these different contexts is going to require not only tailoring in design, not only the elements or the dose of those elements that we choose for one setting versus another, but in how we go about implementing it. What do the different communities look like? What resources do they have? How do we find them and activate them? And in thinking about long-run adaptation within this context, which will look different from one setting to another. Next slide, please. This article argues that we should aim for precision medicine not just to be about treatment and about biology, but that we should aim for our prevention efforts to be just as tailored, just as precise. But the tailoring now may not be to individuals anymore, but to contexts, to communities, to features of setting that make one approach to intervening to prevent obesity more powerful than another. And being able to anticipate how to do that tailoring is a big part of the challenge that we are facing. Next slide, please. So lessons learned so far and future directions that I would recommend for the rest of the discussion to think about over the next several days. Next slide, please. All of this is going to take new science. If we're going to do systems event interventions on a large scale for obesity prevention, we're going to need new science. Next slide, please. Specifically, we're going to need some kind of rigorous approach to project how different intervention designs on one hand might map onto different contexts and starting points for change on the other, bearing in mind this idea of sustainability and adaptation through time. The second thing we're going to need is a scalable approach to reliably, equitably, and effectively engage with communities to undertake this kind of systems change in a way that balances what is realistic in scope for communities to do and is feasible with the need for the breadth and coverage across all these sectors and levels. And the third thing we're going to need are new strategies to overcome systemic barriers to change that exist in many settings in our country. Next slide. In addition, we're going to need wider use of new methods. Next slide, please. So here are three different quotes from three different National Academies reports beyond the Accelerating Progress in Obesity Prevention report, which argue that we need wide-scale use of complex systems approaches and models in particular that can help us meet these scientific challenges, as well as the pragmatic challenges of how to actually practically do this that I've discussed in my presentation. These methods are going to be the subject of later parts of this effort by NCORE Opus. So I'm not going to focus on them in my talk, but I want to highlight that they exist and they can be an important part of the solution. Next slide, please. We're going to need lots of team building and training. These new approaches, systems science methods, are not widely available to everyone. We're going to need additional training in them. I want to point out that you don't have to be an expert in a systems approach or systems science to start using these in partnership with people who do have that training. And I'm happy to talk more about what that team building and training might look like. Next slide, please. I'm right at the end of my time and right at the end of my talk, fortunately. I put my emails on here. I know there isn't a Q&A specifically associated with my presentation, but I encourage anyone who has questions that would like to follow up to please feel free to email me. And I look forward to seeing how the